I'm Rick Buck and I've been a dentist for 15 years. In this video, we will go over the steps to complete a root canal procedure. I will show you all those steps, and as a bonus, you can see what the nerve looks like when I pull it out of the tooth as you would do in any root canal. So let's get into it and everything else about a root canal now, and like and subscribe if you have teeth. So this tooth needed a root canal because it had tooth decay that extended into the pulp chamber, which is where the central nerve of the tooth lies. So this infection was causing a lot of pain. Now the first step you're going to see is to isolate the tooth so its infection doesn't get into your mouth. More importantly, this barrier also prevents what is in the mouth from getting into your tooth. We call this a rubber dam, which keeps the inside of the tooth as clean as possible while we're doing the procedure. And for this and a few other reasons, we can do a root canal procedure without it, but using it increases the chance of a successful root canal. The next step is to make an opening in the tooth's upper portion, or crown. We call this an access opening because this hole gives us access to the root canals that we'll see in a moment. This access opening needs to be wide enough to gain access to every canal in the tooth if it has multiple canals, but not wider than that. And the reason why you don't want it too wide is the tooth can become excessively weakened and fracture over time if you make it too wide. Now that being said, the final crown prevents these fractures most of the time, and if you watch to the end, I will show you what happens when you don't put a crown on the tooth, because this patient happened to not do that. So now you can see the pulp chamber is wide open from the access opening, and we look down into it for all the canals in the tooth, which present themselves as small holes in the tooth's floor. Now we can tell when we found a hole because we use this long pointy metal instrument called an endo explorer. When you find a canal, the tip of this endo explorer slightly sticks into the canal, and when you try and pull it out, you get a little bit of tug back or stickiness. Finding all the canals can be challenging as these canals constrict, calcify, and become smaller in time. In other words, the older you are, the more constricted they get. Sometimes they become so narrow that they seal off completely. It also isn't straightforward how many of these canals each tooth will have. Dentists have a pretty good idea about how many and where those canals are, but it can vary quite a bit from each individual how many canals are in which tooth. For example, this tooth in most people's mouths has only 3 canals, but this one on this patient has 4 canals. Now if we pause, you can look at the floor of the tooth. Can you even see the canals at all? Probably not. I can't even see them. I can only feel them at first with that endo explorer, and later we will be able to see them. Now once we found them, and there's 4, I will start filing each of these canals. Now a little about these canals so you know why we are filling them. When healthy, each of these canals has a nerve and blood supply. If this blood supply dies, your body has no way to fight an infection that gets inside the tooth or in these canals. So the reason we are doing the root canal is to seal off the canals from future possible bacteria and infection. To do this, we start by removing the nerve and tissue in these canals with a long rotating mechanical file. Luckily in this example, when I remove the nerve from the tooth, it wraps around the file instead of getting torn to shreds like it will in some cases. Now, I know this might be a little bit hard to see, so I will quickly unwrap the nerve so you can see what it looks like on the camera. Kinda cool, huh? It's one of the joys of being a dentist. But let's move on. But you may not be impressed because it looks just like a small, tiny cord, I guess. After removing the nerve, we use a series of mechanical and manual files, like I said, to unclog and shape each canal nicely so we can fill them at the end. This part takes a lot of skill, and there are a lot of challenges in doing it. For example, if you go too fast, the instruments can break, which isn't as bad as it seems, so it's always better that we take it slow so that these instruments don't break. Another challenge is if a dentist is too aggressive when filing, the files can make a hole in the side of the root called a perforation, or they can leave the root so weak if they're too aggressive that they will break in the future. Or how about another challenge? because these canals can become so blocked and constricted, it's a big hassle to unclog them. And the last challenge for filing these canals is you have to ensure that you file within 1 millimeter from the tip of each root, or the root can become reinfected again in the future. So it's not necessarily too easy, so it's definitely a skill that you have to refine over time. Okay, so now we're done filing, or what we call cleaning and shaping the canals. And so now we move on to irrigating each of the canals with sodium hypochlorite, or bleach. Now it might seem weird that you're using bleach in a tooth, but that's what you're doing. If you clean and shape the canals sufficiently, this irrigation will kill all the bacteria in the canals and then reach some of the bacteria even outside of the canals if it got there. For some people with significant infections, this can spread quite a bit and cause a burning sensation. And while it's not fun to experience the burning sensation, it kills off a lot of the bacteria in the process. Okay, moving on. We then get the tooth ready to seal everything off. To seal off the canals, we use these long rubber-like cones made of gutta percha. These cones are the same size and taper as the mechanical files that we just used, so they should fit in the canals just like the files that we used. And before we seal these cones permanently into place, we put them in each of the canals and take a quick x-ray just to confirm that the cones will fill the canal to the expected length. And so here's our x-ray, and it looks great. So we irrigate with the bleach one more time, and then we take paper cones of the same size as those gutta percha cones and we dry the canals. After drying them, we mix sealer and we coat the canals with the sealer, and we also coat the cones with the sealer. Once everything has a lot of sealer on it, we place the gutta percha cones back into the canals, and that sealer will seal the gutta percha in place for good. After all that, we melt off the excess gutta percha above the canals, and then we place a piece of cotton and a temporary filling in the tooth. And that's what we're doing right now. Now, from a root canal, you can expect some soreness that will likely differ from any soreness that you may have had before the root canal. And that soreness is due from inflammation as opposed to whatever was causing it before. Now, this inflammation and pain likely will go away in a few days, and ibuprofen normally works best in this case for the pain because also it takes care of the inflammation. When your tooth is in this state with the temporary filling, you need to be careful chewing on this tooth until the final crown is done, because this tooth is in a very weakened state and can break. In fact, this patient didn't return, and so you normally want to return within 2 to 14 days after the root canal is done. Any back or posterior tooth with a root canal needs a crown to avoid this. Now, you may get lucky and be one of the few that it doesn't break, but 80% of the teeth, even though they feel fine, will break at some point in the future if you have a root canal on the back tooth and you don't get a crown. In fact, what's interesting is this patient didn't return for the crown, and that is exactly what happened. Now, it isn't necessarily his fault that he couldn't come in, but months later, here is the broken tooth. Now, if you want to know more about the crown procedure, you can watch my video on crowns for more on that. Watch my daily dental care video I have posted now for the best technique, tips, and product recommendations for a stunningly clean mouth that avoids tooth decay, gum disease, and gives you fresh breath. The best dental products that I recommend are in Amazon affiliate links in the description below. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.